Looking at our death numbers, I think what's important is comparing what we've seen in all of 2020 to 2019. We are seeing significantly more deaths overall in 2020 compared to 2019. Because it takes some time for the cause of death to be determined, there's always a delay in figuring out exactly what that's due to. So that's something we're working very hard to figure out. We know that a proportion of them are going to be directly due to COVID. And we know from both our own data and from international data that there are likely to be some deaths that are indirectly due to COVID-19. For instance, as with influenza, if somebody has congestive heart failure or underlying lung disease, they may have a very minor infection with COVID-19, but that worsens their lung disease or their heart failure, and then they may actually succumb from the heart failure or the lung disease, and we may not even know about the COVID-19. There are other examples that we're seeing that may indirectly lead to death, where people who have chronic conditions, perhaps diabetes, or other ones that require regular visits to a healthcare provider, where because of the interruption in healthcare when things first came about in COVID-19, they may have delayed those visits, and their chronic illness may have worsened, and they may have ended up dying from their chronic illness due to these indirect effects and to the COVID-19 response. So I think it's going to take us some time to figure out which ones are indirectly due to COVID, which ones are directly due to COVID, and if all of the increase can be attributed to COVID or if there's something else going on as well.